Hi.
Hi.
My name is Jeannie. I'm one of the nurses here, and I'll be doing your physical assessment today.
Nice to meet you.
Pleasure to meet you. And can you tell me your name?
My name's Kim Partners.
Great. And what do you prefer to be called?
Just Kim.
Just Kim. Excellent. Well, Kim, as I said, I'm going to be doing your physical assessment today. We are going to be going through some steps. I'm going to be asking you some questions, and I encourage you to do the same. So if you have questions, let me know. Don't hesitate to stop me about anything. So before we get started, I'm going to wash my hands, and then we'll get started. Okay? So give me just a moment. All right. Now, let's start out asking you a couple of questions. First of all, I want to make sure that you understand we're being videotaped today.
Yes.
And I have your permission for that. Is that
Yes.
correct? Excellent. And so what brings you in today?
Just to check out, make sure everything's doing good.
Okay. No problems right now? You're
No.
relatively in good shape?
Mhm.
Okay, good. And when was your last physical exam?
In March of this year,
And what did you see your doctor for at that time?
for hypothyroidism.
Okay, so you have some hypothyroidism. All right. And do you have any other problems besides your thyroid?
Some sleep issues that I've had all my life.
Okay. So how are these being treated for you?
Both on medication. So
Okay.
I take the Armour Thyroid 30 milligrams for my hypothyroidism, and then I take an imipramine for my sleep.
Okay. So there are a lot of things that can contribute to both areas and both problems that you're experiencing right now. With the hypothyroidism, as we do your physical exam, we'll look at some different things such as brittle nails, your skin turgor, things like that that indicate issues with hypothyroidism. So we'll talk about those things as we go along. And as far as your sleep goes, how much are you sleeping at night?
Now I sleep about 7-8 hours, so
Okay.
that's much better than what I used to.
What was your pattern before?
Maybe 3 hours on a good night.
Oh my. Was that consistent or were you up and
Yeah,
down?
that was all my life.
Oh my goodness. And have you had sleep studies?
Yeah, I've had a sleep study, I've seen sleep doctors, neurologists, all kinds of folks. It wasn't until I accidentally found this one medication through another doctor that my sleep improved.
Okay. And since your sleep has improved, has your overall health improved at that
Yeah, I
point?
definitely feel better.
Okay, good. Well, you know, sleep deprivation is a big concern because it can cause all sorts of problems. And you know, your circadian rhythm, we all require sleep, and as we get older, we seem to require even more than we did.
Absolutely.
Yeah. Okay, excellent. So can you tell me if you're taking any over-the-counter medications?
Just a multivitamin.
Okay. Are you allergic to anything, Kim?
No.
No allergies to meds and anything else? Any sort of environmental factors that you're allergic to?
No.
Excellent. You know, in this area, it's really hard not to have some
Yeah.
kind of allergy. So, what about your family history?
My mom's dad died of pancreatic cancer, and then my dad's dad died of a ruptured abdominal aneurysm. But otherwise, there's some high blood pressure, that's about it.
Oh, those are some very odd things to die from. Those are pretty rare. So, okay. Anything other than that? Do you have a familial history of thyroid disease?
Yes, my mom has it, and so does her mom.
Okay. So, what about your dad's family, though? Negative?
Not that I know
Oh,
of.
okay. All right. Well, as I said, we'll talk about that as we go along. One of the things I am going to ask you is about diabetes. Any diabetes in your family? No heart disease?
No.
Problems with the liver?
No.
Okay. And just the pancreatic cancer from
Yeah.
your grandfather's being sort of, endocrine issue. All right. Well, besides the hypothyroidism. So, one of the things I'm going to do today is check your cranial nerves. Now, what they call this is grossly intact, meaning that your reactions would demonstrate that your cranial nerves are working appropriately. We're not going to do any fine-tuning or poking or prodding with anything. But I'm going to ask you to do some demonstrations like whether you feel sharpness or dullness. I'm going to be touching your face, looking at your ears, and doing some quick exams up around your head and neck. So.
Sounds good.
All right. So the first thing we're going to start out with is we're going to check your pupils.
Okay.
I'm going to dim these lights for just a second. All right, Kim. So we have a big light here today, so I just want you to look straight ahead, focus on something straight in front of you, and I'm just going to come at your side and see how your pupils do with the reaction to this big light here. Very good. All right. Do you have any problems with your eyes?
I have contacts.
Okay.
I wear glasses, but other than that.
All right. Any dryness, irritation,
No.
and you don't have seasonal allergies, so no itching, that kind of thing? Okay, very good. And I want to ask you to do a couple of things for me. Can you raise your eyebrows? Very good. And can you wink each eye? One at a time. Very good. You know, I can't do that, so I'm
Okay.
impressed. So, can you smile? Yes, you can. Very pretty smile. And can you shrug both your shoulders? All right. I want you to take my fingers with each hand, squeeze. Okay, very good. Your grips are equal bilaterally. That tells me that you've got good peripheral access and that you're not having any trouble with that. So do you have any weakness on either side of your body?
No.
No left or right? No. Favor one side over the other? Nothing? Okay. All right. So we are going to do something right now that has to do with you sticking out your tongue. I'm going to give you a quick oral exam for cancer, because usually the point where you tend to get cancer of the mouth is under the tongue. So I do want to ask you a question, Kim. Do you see your dentist regularly?
Every 6 months.
Okay. And does your dentist check your, do an oral check?
She does.
Very good, very good. So right now I want you to stick your tongue straight out. Okay. I am going to grasp your tongue, and I'm going to look underneath. Looks like you have all your teeth. Excellent. That didn't hurt, did it?
No.
Okay. I didn't feel any nodules or anything, so that's very good. It's a quick squirt of hand sanitizer here. And let's see where we are. So I'm also going to look in your mouth. I want to check your gums to see if you have any lesions. I want to look at your tonsils. Have you had the tonsillectomy?
No.
No? You still got those tonsils?
They do.
Yeah. Well, you know, it used to be the thing to jerk them out regardless, but now we don't do that. So if you can lean your head back just a smidge. There you go. Just relax. Say all for me. All right. Very good. Very good. I can tell you see your dentist every 6 months. Your teeth are beautiful. So, let's see. And your areas in your jaws, you don't get any sores or lesions or anything like that, correct? So those seem to work very well for you. All right, so we're going to look around your ears. Okay, I'm just going to examine the outsides of your ears to see if there are any areas that I need to focus on. Some gloves on here. Have any sores or any problems with that at all?
No, they seem to be okay.
Okay. Now I'm just want you to look straight ahead. I'm just gonna run down and I'm gonna feel your neck at this point to see if we have any enlarged lymph nodes. Okay. Have you ever been told that you have enlarged lymph nodes? All right. Just feeling of your thyroid now. And do you have any pain or discomfort when I do this? Okay. Now, Kim, I'm going to just run my fingers lightly through your head. And right now, I just want to make sure that we have no lesions in your scalp, any sores, any problems with that. Your hair, is your hair thinning?
Yes.
Because of your thyroid? Okay. It will do that. That's a typical symptom. I'm assuming you have Hashimoto's thyroiditis? Okay. They did test you, okay. What did they tell you about that particular disease? How it would affect you? Did they give you some information?
Not really, other than to take the medication. I should be fine.
Take your medication, you'll be fine.
Yeah.
One of the things that, Kim, as you and I just discussed, is that you will have a change in your hair. Sometimes it becomes more coarse, it tends to fall out. You also have changes in your skin.
Yeah.
It can get very dry. Have you noticed that?
Yeah, I use moisturizer. That seems to help.
That's very good. And your nails, are you having trouble? Are your nails brittle?
Oh, not too bad.
Okay. Because that tends to be a symptom as well. So if they're not brittle, that's very good. Okay. So we can talk about those things as we go along. If you have any questions about any symptoms, just let me know. So you don't have any yellowish tint to your skin. That could be another symptom, or do you? Is that okay?
No.
You're good there. Okay. And memory problems?
Just normal aging, I think, or at least I hope.
How do you tolerate cold?
I have more problems with an intolerance to heat than I do with
Oh,
cold.
interesting. With your disease, you should typically, one of the common symptoms rather, not typically, but one of the common symptoms is an intolerance to cold. But that's very interesting.
Yeah,
I
I
have
have gone the
intolerance.
other way for some reason.
Okay. And are you feeling tired, sluggish, weak?
Oh, just with a lot of movement going on here recently, I'm definitely tired.
Oh, you've been moving. Okay. Well, I don't know who to call next time then if I need somebody to help me move.
No, my daughter's boyfriend has a nice big truck.
Okay, great. So I wanted to know, do you find yourself turning up the TV or the radio and someone telling you it's too loud?
No.
Okay. Do you have any problems hearing my voice now?
No.
Okay, very good. So we are kind of looking at how well do you hear and those cranial nerves that affect that as well, the olfactory nerves. So one of the things I want to do now is I want to get you to lie completely back for me. I'm going to lower the head of your bed. What I'm looking for right now, Kim, is in your neck. I want to see if you have any venous distension, okay? So I'm going to lie your head down. And you look perfectly normal, no venous distension. I'm going to bring you up to a 45-degree level. Are you ready? Just relax. There you go. Don't see any hair. Are you comfortable there? Would you like to sit up a little more?
Oh, yeah, I come up with
Okay.
I fall asleep. Back that far.
Well, I'm glad you're having a good exam. So do you have any trouble with your speech?
No.
Any difficulty swallowing?
No.
Any pressure in your throat when you swallow? Your thyroid feeling large and in heat you're swallowing sometimes? Very good. And do you have any earaches? Excessive headaches? What about cough? Do you have a cough for any reason? Okay. Just let me ask you this real quick. Is your flu shot up to date?
Yes.
Very good. So I'm going to touch your face just slightly, and I need you to tell me if you're feeling sharp or if you're feeling dull. Okay? And as we do this, I'm not going to hurt you, but I'm going to need you to close your eyes, look straight ahead. Close your eyes and look straight ahead. That didn't work. How about just close your eyes? Very good. Okay. Very good. And I need you to keep your eyes closed, Kim. I'm sorry.
Sure.
It's hard to tell, isn't it?
Sure. Yeah. Sure.
All right, I need you to keep your eyes closed. I'm just going to uncover your legs. And we're going to do the same exercise here on your lower extremities, okay?
Okay. Sure. Don't.
Okay. You can open your eyes.
Oh.
Thank you, Kim. So now I'm just going to look at your skin. Just going to lift your sleeves and look at your skin, check your skin turgor. If you're dehydrated, your skin tends to do what we call tinting. So if I pull it up, it tends to stay in that position. I don't see that with you. And with your thyroid disease, that is not uncommon. So, but you tell me you moisturize very well.
Moisturize and drink a lot of water too.
Good. I was going to ask about your water consumption. About how much water do you drink a day?
2 to 3 liters.
Wow, that is a lot of water.
Yeah, I'm always thirsty.
Really? Okay, I'm not surprised with that kind of disorder. Okay, your skin looks very good. Do you have any unusual spots, scratches, bruises, cuts, moles, anything like that?
Other than mosquito bites.
Yeah, tis the season,
Yes.
right? Right. Do you see a dermatologist?
I haven't in probably a year and a half.
Okay. Were you seeing a dermatologist then for a particular reason?
Yeah, I'd gotten a funky thing on my back, so they came and looked at it, gave me some meds, and put one of my
It went away. Did they have to tell you what it was?
Oh, what's it called? Technicolor. It's where you exercise a lot, but then if you don't change your shirt, it builds
Oh,
up bacteria, but it's more like a fungal infection.
interesting.
And so you don't see it other than it prevents your skin from receiving sunlight, so it appears as white blotches. So I was like, I didn't know what was going on, if I was losing my skin color or what. And they're like, oh no, that's very common this time of year. So they just gave me like these 2 pills to take, and that was it.
And it went away. Very interesting. Very interesting. What about as a child? Did you have a lot of sun exposure as a child?
Yeah, I grew up in Florida.
Okay, did you use sunscreen when you
Oh,
grew up in
no.
Florida? Okay. I thought you were going to. You actually don't show to the naked eye a lot of skin damage, which is really amazing. Growing up in the climate you grew up, especially having that super exposure. I would recommend that you see a dermatologist once a year, only because you have that history of being in that direct sun and not using the sunscreen. Because if you were like me, we didn't have sunscreen. You know,
Yeah, it
got
wasn't the
sunburned.
thing to do.
No,
back
it
then.
was not the thing to do. Baby oil and iodine was
That's
the thing to
right.
do. Yeah. So I'm telling my age here, right? So do you use sunscreen now?
I do now.
Okay, all right, great. Do you use it on your face every day or just
Every
when?
day.
Okay,
Yeah,
very
it's in my
good.
moisturizer.
Very good. And what's the SPF of that?
I think it's 35.
Okay, good, because you need to use at least a 30 on your face. Yeah.
Very good.
So, anyway, I'm shuffling papers over here. Please understand, I just have to look at your medical record as we do this. So, now, I'm going to listen to your heart, okay? I'm also going to listen to your neck, your carotid arteries in your neck. I don't want you to be alarmed. I'm not going to put any pressure on anything, especially your carotid, but I just wanted to take a listen. So, your vital signs were very good. I see that your blood pressure was like 118/72. Is that about normal?
Yeah, that's about where I'm at.
Excellent. Helps that you're athletic. Okay. So listen to your neck. It's maybe a little cold. I'm gonna listen over your thyroid actually. What we do there when we listen to that is check for bruise, which is an abnormal sound that can happen sometimes with thyroid disease and other issues. So I'm also now going to listen to your lungs. Have you take some deep breaths for me? Very good. Once again. No problems with your lungs, right, Kim? Do you mind sitting up for me so I can listen from the
Yes.
back? Excellent, thank you. Deep breath. And again. Deep breath. And again. Okay, can you say blue moon for me? Okay. Sounds like a good little echo in there, which is what you want to have. All right. You have any difficulty breathing, anything like that? Kim, are you a smoker?
I used to be.
Okay.
I haven't smoked in like 10 years.
10 years, very good. Were you a heavy smoker at that time?
About a pack a day.
Okay. Heavy enough, right?
Yes.
Right, okay. So have you had any symptomology? Have you had chest x-rays since you quit smoking?
Yeah.
Okay.
Yeah, I came back from Hawaii in 2007 with like a really bad case of like pneumonia, and so they did a chest X-ray then.
Okay.
Just gave me some antibiotics and a nebulizer and set me on my merry way.
Okay. But you don't continue to have any problems with your lungs or anything? No history of asthma? Nothing like that? Correct. Okay. All right. So I'm going to, once again, lie you a little bit flatter, and I'm going to listen to your belly. You tell me you have some trouble with constipation?
I did until they upped my dosage on my thyroid, and then it went away again.
Okay. All right. I'm also going to do a little pressing on your tummy. When I press on your sigmoid colon, that's going to be a little uncomfortable. It's not going to hurt, but it is going to be a little uncomfortable. I just want you to be prepared for that, okay? Nothing worse than doing it and going, ow, that hurts. Yeah. All right, we're going to listen for some vowel sounds, Kim. Make sure they're your bowels are being active. It's a little sluggish, but I do hear them. Do you take eat any sorts of food that help you with that constipation, or just your
I
medication?
do a high fiber diet.
Oh, do you? Very good.
Try to eat healthy most of the time.
Ouch. Well, you tell me you exercise a lot, so you have to eat healthy, right?
Try to.
Okay. So I'm just going to push gently. I don't want to hurt you. If I do anything that's uncomfortable, I just need you to tell me. Any hernias, anything like that?
No.
Normal belly button?
Yes.
Okay. Any abdominal pain whatsoever?
Mm-hmm.
Okay. And when was your last bowel movement, Kim?
This morning.
Okay, very good. All right, I don't feel anything abnormal. So, have you had any blood in your stools or any bleeding when you have a bowel movement? No. That's good. That's good. Now, tell me about your reproductive. I'm gonna sit you back.
Oh,
there. You look like you're not quite as comfortable as you could be.
There we go.
So there we go. So tell me about your pregnancies. You've had
I
children.
have 2 children, 2 girls.
Okay. All
One
right.
was a normal birth, the second was an emergency. It wasn't even a C-section, it was a laparotomy, and they took both the baby and my uterus.
I see. Package deal, huh?
Yes.
Did you abrupted?
Yeah, a placenta rupture and uterine rupture at 33
Oh my.
weeks.
Oh wow. Wow. That is, you're lucky to be alive.
Yeah, I got the helicopter ride to the hospital and everything.
You've had a lot of fun,
Cleaned
huh?
their blood bank out of blood and
Wow. Wow, Kim, that is really something. Well, I'm glad to see that you're doing well. You haven't had any problems since then, have you? So with your history, I'm assuming you still have both your ovaries.
Still have my
right?
ovaries.
Okay, all right. So have you had any menopausal symptoms at this point?
hot flashes in the past year and a half. Was having some night sweats, but I've been taking like an over-the-counter soy-based product, and so that stopped. So
Okay.
it's been nice.
Okay, so that works well for you,
Mhm.
right? So you are not taking any sort of hormone replacement
No.
therapy, the HRT. Okay. So you know with hormone replacement therapy, you need to be careful about the length of time you're on it if at some point the doctor does prescribe that for you. You should probably take it no longer than a year because of its predisposition for breast cancer. Yeah.
Wow.
Yeah, so we don't want to cause you any
No,
other
yeah.
problems besides that. So, we don't have a period, so we don't have to talk about your last menstrual period, and you say you have no other problems besides that. We're gonna defer your pelvic exam. I'm assuming you get your pelvic exam.
Yeah, they still do it
annually.
Pap smear since they still do it with my cervix.
I was gonna ask if you still have your cervix, okay. So you do have your Pap smear, no abnormalities with that.
Always been normal.
Excellent, that's very good. So let's talk about your breast. I'm going to defer your breast exam, but I do want to ask you some questions, okay? You appear symmetrical, so have you ever had any sort of lumps, bumps, anything like
They
that in
do
your
get
breast?
lumpy bumpy just from the fibrocystic tissue, and years ago they did a mammogram, and they said it's just the fibrocystic tissue, and it's more sensitive when I drink a lot of caffeine. It's more
Yes.
painful and bumpy. So as long as I go easy on that and just limit to the morning, it seems to be okay.
Now, caffeine does tend to precipitate fibrocystic breast disease, causes, and that includes chocolate. And
Chocolate.
Yes, chocolate.
No.
So chocolate unfortunately has a lot of caffeine in it, so those kinds of things you do need to avoid to keep that down. Do you have an annual mammogram?
They just started doing annuals this year on me. So
Okay,
I had the
okay,
last one in March, and it was
okay.
fine.
All right, very good. So do you do self-breast exams?
In the shower.
You do? Excellent, excellent. I'm so happy to hear that because a lot of people skip that.
Oh,
So.
really?
Yeah. So are your nipples symmetrical? Do you have any inversion, any pitting anywhere on your breasts?
No.
Okay, very good, Kim. That's very good to hear. I want to encourage you to continue to do those self-breast exams and to have that mammogram annually, okay? Because it's amazing what they can catch with those things. So any bruises, rashes, cuts, anything
No,
like
just
that?
mosquito bites
Just
on
your
the legs.
mosquito
Yeah.
bites, all right.
They're very itchy.
Oh, okay. Have you tried some hydrocortisone cream
Yeah.
on those? And they also make a Benadryl cream that might be beneficial
Yeah.
for those. And some lady was telling me that actually there was an old home remedy of mixing baking soda into a paste and applying it. It would take the itch
Okay.
out. I don't know if
I can
that
try
works.
it.
But if you want to walk around with baking soda on your legs, that's fine. Do you bruise easily? No? I'm going to check your feet. I just want to make sure we have an equal temperature on
Oh, sure.
both your feet.